We told you that today on Startup Central, we're going to be putting the spotlight on the new age COVID warriors. Our next guest, Hemkunt Foundation. On today's episode of Startup Central, we bring you an organization, a foundation that has really stepped up to the challenge, providing oxygen 24/7, relying on a large network. I'm talking about the Hemkunt Foundation. And joining us now is Mr. Harteerath Singh, who's in charge of community development at the foundation. Mr. Singh, thank you so much for joining us here on ET Now. I think we've all been seeing how the Hemkunt Foundation has been working tirelessly to bring the people of Delhi NCR oxygen. You have had many battles to fight, whether it was oxygen being stopped at borders, to just making sure that the supply stays and people get access 24/7. Sir, at the time of this interview, just so that our viewers in other parts of the country also get to know about what all you have done, can you share with us how many people you have served so far in the last couple of days during the second wave, the initiatives that have been carried out?
So to give you a brief of the organization, we have been working since the past 11 years, but obviously this is the worst we've ever seen. We have three major initiatives for COVID itself. The first is the regular oxygen cylinder drive, where we distribute oxygen cylinders. The second is a drive-through where patients can actually come and they're treated by our own doctors and medical team. And the third is a 700-bed facility, which will be launched tomorrow itself. So these are some of the initiatives we have been doing pan-India. And on a daily basis, I feel we serve 4,200 people on a minimum basis, but we have the capacity to at least expand and serve 10,000 people daily.
I'll go by this one by one. I'll take vaccination right in the end. I want to start with oxygen because you've done a lot of, if I may say so, which is what you do, seva, when it comes to that, which is so integral to, Hemkunt Foundation and your faith. Mr. Singh, but can you tell us how it is that you are getting a supply of oxygen, how you are setting up, whether it is a drive-through or refilling centers, etc.?
So we are majorly importing oxygen cylinders and concentrators as well. India isn't at a very good place, to be honest. We are facing a lot of shortage. Even if we do manage to get the cylinders, we aren't able to, manage to refill them. So it's obviously an issue, but we are setting up our own PSA plant as well. So at least we can refill our own oxygen cylinders and cater to more people because there is a shortage and there's a crisis to even refill the cylinders. So it's all about the demand and supply. And unfortunately, the supply in India is very low at the moment.
Are you also looking to import?
We are already importing concentrators and cylinders from China and Hong Kong.
Mr. Harteerath Singh, can you give us an idea whether those shipments have arrived? There have been certain reports that it's taking time for concentrators and oxygen-related equipment to clear customs. Is that something that the Hemkunt Foundation has had to battle?
Definitely, we need to battle all of these problems. And the major one is that China is celebrating the May week. In India, we call it the May Day. But China has been closed for 1 week. Unfortunately, we planned in a way that we'll be getting everything in batches. So one of our shipments will obviously take time. But we have other sources as well. We're not just importing cylinders and concentrators from this China. So fortunately, we plan in a way that if one shipment does get cancelled or disrupted, we have other coming into, COPA.
Mr. Singh, you were talking about a vaccination drive as well. Can you tell us more about that?
So we need to also focus majorly on the rural areas, and that's basically a project in the pipeline. But for us, the priority will always be oxygen because we can't let people die. The vaccination drive will be something which will be looked at in the future, but right now our complete focus is on the oxygen drives.
Can you give us an idea of the number of volunteers that are there on the streets, the COVID warriors on behalf of Hemkunt Foundation?
So in Pan India, we have 150 people on ground. Obviously, the backend team is a lot more larger. We have the top CEOs of all these startups supporting us. They are a part of our team as well. They manage all our backend, the logistics, the paperwork, because we need all hands on deck. So even our backend team, the finance team, the social media team, they're all on ground. So we have people coming up. You name the top CEOs of the startups or the big, all the big companies. They are basically a back-end team right now. So it's a collective effort, not just Hemkunt Foundation, but everyone's working together.
Mr. Harteerath Singh, it has been documented that you yourself have been reinfected, that you've had to suffer COVID-19 twice, that you're barely getting any sleep, and that one of the questions that you have been asked, and I would like to also ask you, how is all of this being made possible? Because you're not charging for the oxygen cylinders, whether it is for the drive-through or whether it is for delivery. How is all of this being sustained? Is it also primarily via donations?
So we're always 100% publicly funded, and it's the people who are running. It's the people of this nation itself. Koi bahar se, it's not an external force, as we usually call it. They're all people of India. They're all the companies of India. They're all major companies giving us CSRs. That's how we run it. And of course, we started Seva, in the Sikh faith 400 years ago. It's still going on, and we'll always continue to do so. Whatever the circumstances are, we will never step back.
Okay. And sir, could I also, want to take this forward and ask you, during the second wave, everybody is scared when they or their loved ones get COVID-19. We keep hearing doctors, whether it is Dr. Naresh Trehan of Medanta, Dr. Randeep Guleria of AIIMS, saying, don't be scared. Agar ghabrahat bhi hogi, monitor your oxygen. If it's more than 94, 90, don't come to the hospitals. At Hemkunt Foundation, when you're giving such a big helping hand, how are you battling this? Because everyone thinks they need oxygen, or their parents need oxygen, or their loved ones need oxygen. And it is a scarce resource.
We are not doctors, I would say, but we are volunteers. We are a humanitarian aid organization. Even if the doctors don't accept patients below the SpO2 level of 90, we will welcome everyone, whosoever comes at our doorstep, be it with a patient of oxygen level 40. हम उसको भी stable करते हैं. We make sure the patient is stable. The amount of resources we are putting in, doctors will usually not invest the time or the oxygen cylinders at a patient who's very critical. And we know we lose them at some point of time, but our focus is to extend the life of everyone, even if it's for just another hour.
Have you relied on the power of technology or social media to help out? Has it helped at all?
Definitely. We have chatbots on all our social media accounts. You drop a message, and we have a helpline number as well, which is 24/7. We are constantly responding to SOS calls on Twitter. We all know how Twitter is working these days. Everyone's on Twitter, and we have been responding to all the SOS calls that are sent to us. So I would say social media is our largest strength right now, because that's where we amplify our work, and that's how we also cater to a lot of SOS calls.
Because you are on a national level platform, I'd like to ask you, for those, most of us are spending our free time doing what on social media, trying to match plasma for someone, find an oxygen bed for someone, find a cylinder for someone. Mr. Singh, are you taking in more volunteers? Are you recruiting volunteers? And if there are those that want to volunteer, how can they do so?
Definitely. Even if you want to volunteer or support us, just reach out to our website. It's hemkuntfoundation.com. We have all the details there. We have weekly volunteer induction as well, because we need all hands right now. It's now or never. I need each person to actually come forward, because we don't want to, be in a situation where it's too late and we end up losing a lot of people. So we need all hands on deck, and we need everyone to support us, even if it means that you're supporting us from your own home.
And what about money? Are you now taking donations? Where can people donate?
So it's the same link. It's hemkuntfoundation.com/donate now. And we have all the donation portals there, because we are here because of your donation, because of your money. It's all publicly funded. So we constantly need your money and your donations and your support to expand our work, to actually start and amplify these all models in different cities as well. We are now looking to give 5 concentrators, 10 concentrators to mandirs, gurdwaras, so they can actually use this space and at least open a short-term relief center. So at least it will be of some help to the locals there. So we are constantly expanding. We have models ready, but we are always waiting for resources to come in.
I was reading an interview of yours dated April 30th, soon after the oxygen langars and the drive-thrus that had started. Mr. Singh, you had also raised this issue, saying that we're nowhere near the peak, that you're visiting manufacturing facilities and people have not woken up. We need more. Has there been a change in the last 5 days? Since you're on ground, I'm asking you this.
It's just getting worse. There's no improvement, to be honest. And we have seen a rise in the number of deaths as well, because I am there during the night as well. So I know the amount of dead bodies that are going through. And it's basically, there is a high number of patients that are being literally dumped at our doorstep ki hospital mein jagah nahi hai, we don't have an ICU. So the ambulance will actually leave the patient to us, ki aap dekh lena, and we are just going. So the number of such cases have seen a lot of rise, I would say a rise by 200%. So the critical patients are obviously growing, and it's only going to get worse.
Mr. Singh, if you could get an audience with the government, the top government official, and since you're on ground and you look at what all you've organized, the Hemkunt Foundation, what would you ask the government to do? What are the 2-3 things that can be done to try and fix this ASAP?
We can import oxygen concentrators and cylinders. Why can't you? It's very easy and simple for you. Just get in more concentrator cylinders, set up more PSA plants, because PSA plants are more sustainable. You'll not only fulfill the current requirement, but even if there is a third wave, which I'm hoping will not be, you'll still be able to meet the requirement of the locals, because right now you can't refill cylinders for everyone. And there's a shortage of PSA plants itself. PSA plants will help you in order to fill the gap. So that's also a major point which the government should focus on. And set up more hospitals. If we can set up a 700-bed facility, why can't you?
With that, Mr. Singh, I hope the government is listening. Thank you so much for all of your efforts, for everything that you have organized, and the entire team at ET Now. And we wish you all the very best.
Thank you.
Thank you.